Hey, nursing students. This is Nurse Ed Scholar here. Today, we are going to dive into body fluid intake and output. Real short videos just to give you the nuggets that you need. Now, this knowledge about fluid body dynamics uh, and understanding fluid and electrolyte balances in the human body is really important. Okay. When we are discussing body fluid intake, water comes into our bodies through various sources. Orally ingested liquids, water, foods, and the metabolic breakdown of fats, carbohydrates, and proteins. I mean, did you know that uh, I think for every 100 calories uh, of these macronutrients, so the breakdown, like 100 calories, uh, produces about 10 milliliters of water. So I guess that's just, letting you know that there are, when food is broken down, it also produces water, and this is considered part of the body's intake. Okay. Now, when we're also looking at body fluid dynamics, um, you have to look at the role of the kidneys. Okay. Now, the kidneys control fluid and electrolyte balance, excreting uh, you know, fluid. And, the kidneys are incredible because they can adjust the amount of fluid that's excreted and, in addition, the amount of electrolytes leaving the body based on what the body needs, what is their intake, so let's just say, a person, they've been working and they really haven't been able to, drink a lot of fluids like they normally would. So the body adjusts to that. The kidneys are wonderful and it can adjust the amount of water and electrolytes that leave the body based on the person's intake and their metabolic needs. Okay. Now, when we also have to, we're talking about take, but we also have to talk about, how is water lost? Uh, the body loses water and they call it insensible loss, and they say that because we don't even know we're losing it. We have no idea we're losing this water. So our skin and lungs play a role in this loss of water. So the skin loses water with sweat, so perspiration. So if it's really hot outside, and our body sweat, based on, how much sweating our body does, that equals how much, water or fluid that we're losing. And then also the lungs release water through expiration, through expired air. Now, this loss of water, deals with the breathing rate and the depth. So if you have somebody who is, hyperventilating, they could be losing more uh, water, more water uh, through that expired air. So these are just ways that, we have to, as nurses, realize that our patients are losing water, uh, especially during certain uh, medical conditions that the patient uh, could be uh, could be experiencing. Okay, and lastly, we talk about the skin and we're talking about the lungs, but then we also have to think of our GI tract, the gastrointestinal role, in fluid and electrolyte imbalances. So, you know, the the gastrointestinal tract moves, I guess, a significant amount of electrolyte containing fluids. All righty. And the body is really smart. It has a way of absorbing the majority. or almost all of the fluid that goes into the GI tract or the gastrointestinal tract. However, when a person has severe diarrhea, this can really disrupt the balance, leading to significant, substantial fluid and electrolyte losses. Okay. And with that, I'm jumping ahead, but then that would also cause an acid base imbalance. Okay. So, when we're thinking about it, healthy organs, the GI tract, you know, uh, it does a great job with maintaining fluid balance. But like I said, diarrhea, I keep saying diarrhea, it's something important. With diarrhea, there's a high risk of fluid and electrolyte imbalances. So remember that, okay? Understanding how uh, diarrhea can affect the fluid and electrolyte, balance is very crucial in nursing. Okay. So with that, like I said, small nuggets, stay tuned for more fluid and electrolytes. I have, many more short lectures for all of you. So look up for some more upcoming videos from Nurse Ed Scholar. Remember, knowledge is power. And just understand that it takes time. And that's why I'm giving you a little bit at a time so you can digest it. If you like, please, hit subscribe for more little digestible nuggets. We're just getting started. We have a lot more to go. And hopefully all of this information over, the time is going to help you in your nursing practice. So I guess stay hydrated. I don't know. And stay informed. Until next time.